Hi, I want to show you one of the best exercises that I know to help in hip structure and function. It also helps relieve the lower back and helps your knees as well. Okay, so the exercise starts in the beginning by just learning how to control the legs and the arms. I'm going to get you to do the same thing with your arms as you're doing with your legs. So bend your knees slightly, round the back out, turn your shoulders in and bend the elbows. Then turn the shoulders out, straighten the elbows, turn the shoulders in and bend the elbows. Round the back out. 4 stages. Stage 1, turn the shoulders out and expand the front. Stage 2, straighten the elbow. Stage 3, turn the shoulders in, bend the knees. Stage 4, bend the elbows. So 1, turn the shoulders out. 2, straighten the elbows. 3, turn the shoulders in. 4, bend the elbows. 1, turn the shoulders out. 2, straighten the elbows. 3, turn the shoulders in. 4, bend the elbows. Simple. Now we learn to do this on one leg. So I'm going to turn away from you, shift the weight to your right leg, come to the left toe tip, so you round the back out, lengthen the front of the left hip and step it back behind you. All the weight will be on your right leg. And then from there, we do the same with our arms as our left leg. So start with your knees bent, your left hip extended, and your shoulders and thigh turned in, elbows and knee bent. So 1, turn the thighs and elbow out. 2, straighten elbows and knee. 3, turn the thighs and arms in. 4, bend the elbows and knees. 1, turn out. 2, straighten. 3, turn in. 4, bend. I'll show you from the side. Round the back out, extend the left hip. 1, turn out. 2, straighten. 3, turn in. 4, bend. 1, turn out. Elbows and shoulders and thighs. 2, straighten, elbows and knees. 3, turn in, shoulders and thighs. 4, bend elbows, knees. 1, turn out. 2, straighten. 3, turn in. 4, bend. 1, turn out. 2, straighten. 3, turn in. 4, bend. And you continue to do this. And I'll do it, 10 to 100 times. And if comfortable, you lift the leg off the floor and do it with the leg off the floor. Now, when you're doing this with the leg off the floor, I'm just going to face this. You can hold on to something. So I'm holding on to something, and notice when I'm doing it, I'm not moving the top of the hip. So I don't need to use my arms, but it's better if I do. So I'm not letting the hip go up and down. That's important. And I'm also not letting the knee go in front of my hip. So keep, if possible, the back lengthened and the sense that when you lift up, you feel the hamstrings or the buttocks work. So when I turn my thigh out, the buttocks works more. When I turn my thigh in, it's the hamstring that works more, which is good for the knees and the hips respectively. So make sure that when you're doing it then, and I'm just doing it with left hand and left leg. I go turn in, turn out, straighten, turn in, bend, turn out, straighten, turn in, bend, turn out, straighten, turn in, bend, and I keep doing it. And this is a really good practice. And I can also do it on the floor. So I can put my hands on the floor and do it. And I can do either the same hand or the opposite hand. So I go from there, turn in, bend, turn out, turn out, bend, turn out, straighten, and then turn in, bend, turn out, straighten, turn in, bend, turn out, straighten. And in the beginning, for most people, it's better if you bend the right knee, but once you're flexible, it's good to keep the right knee straight. And what that does is really good to release the front of the right hip, because the weight of your body pushes down on the right hip and pushes the femur, the thigh bone, back into its socket. And often it's the front of the hip that gets very compressed. Many people in modern life like this. So this is a great exercise, and try and relax your abdomen as you're doing it, and then you can carefully stand back up. So let's do the other side. So start with turn in, turn out, straighten, turn in, bend, turn out, straighten, turn in, bend, turn out, straighten, step back the right leg. So slide back the right leg. It helps if you round the back out first. And so now we're going to go with the leg on the floor. We bend, turn in, turn out, straighten elbows and knees, turn in, shoulders and thigh, bend elbows, knees, turn out, straighten, turn in, bend, turn out, straighten, turn in, bend, turn out, straighten, turn in, bend. And if you wish, you can lift the leg off the floor. And for many people, it's difficult to balance, so you can hold on to something like this. If the balance is good, you don't need to hold on to anything, and you can use two hands. Try not to move the top of the hips if possible. See, I'm moving the top of my hips, but it's better if you keep it still. And always good to avoid arching the back, so don't arch the back. Let it round out slightly while expanding the abdomen. It looks a bit silly to expand the abdomen, but it's much better for your health. So avoid pulling in the tummy and doing this. That won't help you. Let the back round out, let the abdomen open up, and that frees up all the muscles that need to be worked around there. It frees your internal organs as well. So this is on the same side, and I'm holding the wall with my left hand. And I can also do it free, or I can bend my knee and come to the floor, and I change hands. So now I'm going to do the right leg and the left arm. And in the beginning, many people can't touch the floor. The left knee can be bent. But if you can straighten the left leg, notice I relax my front thigh muscles, my quadriceps completely, and that means the front of the hip is less tense. And I use the body weight to push the weight of my body through my pelvis down through the hip socket, and that releases the pressure at the front of the hip. So it's turn in, turn out, straighten, turn in, bend, turn out, straighten, turn in, bend, and continue like that. And notice I'm also doing the same with my fingers and toes. The fingers and toes are opening and closing. And this is such a good exercise for the hips. And then when you finish, carefully come back up. And that whole exercise can be done with a synchrony of the breath. And it gives you a lot of freedom in your hips, a lot of strength around your knees, a lot of pain relief around the front of the hips, which is very common in older adults these days. Anyone over the age of 50 has a 50% chance of getting hip pain, and it relieves a lot of lower back problems. Plus, gives a lot of internal organ work, which is really great for your health, vitality, and energy levels. And it moves blood. You feel warm. It's a cold day, but I feel warm. Thank you very much.